Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Thank you for joining me today, Julie.
Thank you.
I want you to clarify something for me. This past week, the World Health Organization said that asymptomatic carriers are not spreading COVID as much as they thought. But then the U.S. Centers for Disease Control and Prevention has said, well, that's not exactly true. Can you help clarify?
Sure. What the World Health Organization said may indeed be true, but why it's so confusing, especially in the US, is because we use pretty much two terms. We say that you are either asymptomatic, meaning that you're not showing any symptoms, and that's usually like self-reported, or you're symptomatic, meaning you have symptoms. When it's really more of a continuum. So there's asymptomatic, which means you will absolutely never go on to develop symptoms. That's the truly asymptomatic. But all this is pre-symptomatic. So at that point, while you don't have symptoms, you're going to go on to develop symptoms. So you are still infectious 48 hours before you develop symptoms. And that means during your asymptomatic period. But you're not technically an asymptomatic person, because you will eventually go on to develop the symptoms. So it was an unfortunate thing that how it was said in the media, but it wasn't that it wasn't true. It's just that it was very confusing, and especially during like a pandemic or a time of crisis, people want to grab onto every little bit of hopeful information. And so as soon as I heard that, I went on Facebook on the public health site and said, okay, let's discuss this, because I didn't want people to misunderstand it. And of course they did, because it was confusing. So luckily the next day it was cleared up by the World Health Organization as well. You have to remember that the World Health Organization, they mostly communicate with other places around the world, and they deal with a lot of really countries that are developing and that don't have a lot of resources and have a lot of communication issues. So we get our information from the CDC, and often the World Health Organization does as well. So that was really nothing more than kind of a communication, a little bit of a communication misstep. It wasn't wrong, but it was just really confusing. So just to clear things up, you absolutely can transmit this while you're showing no symptoms. You may be clinically pre-symptomatic, but you don't have symptoms. So absolutely, that's why the mask wearing and the distancing are important all the time.
Speaking of symptoms, I woke up Friday morning. I had a low-grade fever, about 100.6, chills, achy, sore throat, and I panicked and I drove out to the mall and I got the test, which was completely painless. It went quickly and I got my negative results the next day. Did I overreact? Should I be saving that spot for people in healthcare and frontline, or was that the right thing to do?
That was 100% the right thing to do. Anyone who has any symptoms needs to test immediately. The reason why, it's not like there's a specific treatment for you, but it allows you to get that information, and then it allows public health to do our job of trying to find anyone you may have had contact with, get you isolated and taken care of while you're still infectious, and anyone you came in contact with, we do the contact tracing and the quarantining of them and testing so that we can make sure that it doesn't spread. So anyone with any symptom, it can be even the unusual symptoms like, a sore throat, or not a sore throat, but that's kind of more of it's less common, but even like losing smell and taste, get out there and get tested, because that's important information for slowing the spread. So you did the right thing.
Okay, contact tracing. I'm glad you brought that up. Last week, a lot of the restaurants opened up, maybe 2 weeks ago, the outside part of it, and people are sitting out there. And how are we tracking if there are outbreaks? When they go to restaurants, are they asked to give their name and number, and so we can follow up with them?
Right, and that's what we're asking, just to help us with that. And I can say, so far so good with the restaurants opening up outside. It's people are really doing a great job with it. We have had some complaints of people not masking, but I do want to be clear. Employees of the restaurants need to be masked. And people, that's to protect the customers and the other employees, but also when you go into the restaurant, please wear a mask. Obviously, if you're sitting at your table with your group and you're 6 feet or more away from other people, you can take it off. But it is very important. And we ask that the public, if you're noticing that the restaurant or retail outlet or whatever is not doing the right guidance, they're not masking and asking others to mask, speak to a manager. And if you are at risk or you're concerned, let them know that you're not going to go back there unless they are ensuring the safety of their employees and the public. So, public health, we can only be so many places. There's not that many of us. So we're not going to be running out there checking on everything. For the most part in our community, it would appear that people are really using the masks and trying to do the social distancing when at all possible. And that is having a very noticeable impact on our positivity rate in the community, because almost all of our outbreaks are associated with workplaces. So again, we have to remind people that if you have someone come into your workplace and they're infected, as long as you're doing infection control strategies really well, you won't have an outbreak within your facility, no matter what it is. So that's why these things are so important moving forward, and that we really get used to doing it, especially before fall and winter, when we'll have other issues to deal with as well, like other respiratory viruses. The same thing that's stopping the spread of COVID is going to stop the spread of flu, other coronaviruses, other cold viruses, all kinds of things. So hopefully we will be well practiced at that by this winter.
Well, you do a good job of congratulating our community, and we're doing a great job trending downward. 16 states are trending upward. We can't close the borders of Illinois. So how do we keep this trend continuing down for us while others around us are spiraling?
Well, the same thing we're doing now is what we'll do going forward. Again, if somebody comes into our area and they're infected, as long as we're doing what we need to do, we can prevent those outbreaks. And if somebody tests positive, public health, what we do is we go in, we isolate them, we investigate them, contact trace and quarantine, and then shut those down. So all the time we're just going to be hopefully just shutting down little outbreaks all over the place, and not have a big massive outbreak that then just keeps going out and further and exponential growth. So the problem with these other states is that they're trying to go back to normal. Doing a lot of outside things are perfectly safe. They can be done safely. Lots of things can be done safely outside. When you start getting into buildings, a lot of stuff can be done safely as well, but it still requires people not to be within 6 feet of each other and to do some other measures. And the masking inside of the buildings, no matter what you're in there for, is important. So that is going to have to happen, moving forward until the pandemic ends. But we're getting ready to probably the beginning of next month go into level 4 or phase 4. That doesn't mean that the virus is not out there. That doesn't mean that anything has changed, except for we're going to start opening it up so that we can have reduced capacity inside things. So whether that's reduced capacity inside of restaurants, reduced capacity inside of other things up to 50 people, we will still be doing the same thing, where we will keep an eye on everything, and if there is a case, then we will go contact trace everyone from there. And that's why it's so important with the restaurants. While we're not really expecting any outbreaks with the outside, it will be more important when we go to the inside space, because there is more of a likelihood of having an outbreak in a situation like that. The outside is almost more practice at this point, but it is a good thing to do. It really helps us out a lot. And it prevents us from having to go to the media and saying, hey, anyone who was at this restaurant from this time to this time, please give us a call. Because when you do that, you tend to get a lot of people who may have been in there the week before or something and really aren't at risk. So this is just a more effective way of doing it.
The US Surgeon General has a great quote. He says, "Some feel face coverings infringe on their freedom of choice, but if you wear them, we'll have more freedom to go out." Isn't he saying simply that if you put on a face covering, then you're free to move about your county?
Uh, Pretty much. I mean, and again, I think that's why we're having such success in our uh, county. If you go around, you go into different places, you're really seeing a lot of mask wearing in public. Where was I this weekend? And I was just like, look around, every single person has a mask on. And that to me is so, it's so impressive. And I think it partially just shows what a caring community we have. Um, I don't even, I mean, I don't know what some people think about when they put on a mask. Nobody likes to wear a mask. It's an unusual thing to do, but you're really protecting other people. And I don't, if you can transmit this when you don't have any symptoms, the only way you can prevent it is to wear a mask all the time when you're around others. And so to me, that is just an absolute no-brainer. I can't even imagine how I would feel if I infected someone who died or had a really negative outcome. I can't even imagine that. So to me, wearing a face mask is a very simple thing to do. If people don't have access to face masks, we are definitely going to help them get access to face masks. But it really is a very small ask to help protect others' health.
We seem to have flattened the curve and we are out there, we're social distancing, but we're spending more time together. Have we gotten more lax in this? Are you afraid that we're going to suddenly see a spike?
Well, at some point we may see a spike. I don't necessarily look for that to be this summer. I will say that we did anticipate cases from the reopening, and we did anticipate cases from the protest. But they're very minor. They're very minor. And I think that is a testament to our community. That's pretty much all I can say about that. It's a testament to the mask wearing and the social distancing when people can. And so again, the concept of flattening the curve is just to keep it, kind of, I always say, like, low and slow. We're not going to prevent all the infections, but we have to prevent this. We're going to see this, and that's okay, and we've seen this all along, but we cannot see this because, and unfortunately, that's what a lot of other states are seeing right now. And it has to do with your catchment area of your hospital, like we've said before. And so people are kind of, masking up and doing what they need to do, even though it's not the most fun thing in the world to do, but they are keeping our curve flattened down here, and they are protecting our healthcare system, and that protects the health, again, not just of people with coronavirus, but also people who may need to, at some point, they may have a heart attack or a stroke or an asthma attack or a car accident or a surgery or any number of things that if the hospital capacity is not there, then they're going to be negative consequences for that.
So I know that I hang on your every word, but I also listen to our governor, Governor Pritzker, and Dr. Anthony Fauci. I also listen to both of them. This week, they both said it's not inevitable that we will see a second wave. That is contrarian to everything that I've heard so far. What do you think about a second wave?
Well, nothing is a given during this. This coronavirus thing is so different, but it would be unusual if we don't have a second wave of more increased cases. And it's only predicting it, but again, I've been most concerned about like late fall and winter for a variety of reasons, and I hope that we can prevent that. I know that our community will do a great job of getting flu vaccinations to help protect our hospital system, and I already know that they're doing a great job with the mask wearing and the social distancing and the hand washing and everything like that. So if that continues, I'm not saying that Champaign itself is going to have, I hope to God we don't overwhelm our healthcare system ever, but it's pretty unlikely that, this is just going to stop. And therefore, I don't know how we would not have a second wave. Again, it in the fall and winter, there's a lot of things that put more pressure on the virus. So people will be, or puts more pressure on our system. But when you're closer together inside, and you're not outside doing things, that's more risky. If schools are in, the university's in, there's a lot of the university. I know that they can do a good job of keeping the kids apart when they're in classes and doing that type of stuff. But we all know better than to think that we can keep kids from staying apart. I mean, it's just not realistic. It's not realistic. And so when you have a bunch, gathered together, there is definitely the likelihood for an outbreak. Again, we have a lot of contact tracing capability in this community and with the U of I that we can definitely get on top of something early. It's not that it's the cases that are so concerning, it's the spread that could get into causing hospitalizations and deaths. That's what's concerning.
I have not heard the Champaign-Urbana Public Health District say, don't go to church or your mosque or your temple, just do it with caution. So tell me where you stand. What are your suggestions if people want to return to their congregations?
Well, there's always guidance out there. I mean, there's been guidance out all along. Earlier, the guidance, of course, it had to link up with the stay-at-home order. So that was when people were told not to be going out at all. So there was guidance given for that. The electronic, or whatever you call them, web-based services and different things like that. A lot of people got creative and did like drive up and drive in services, and people have been doing outdoor services. So there's a lot of things that are being done. And there are people that are back in their actual churches or places of worship. And they can go in there with, restrictions to make it safer. We have guidance put out by that. But the fact of the matter is, if a church opens and they're going to church, or a religious organization is open, the guidance is out there. We're telling them why it's dangerous and what could happen. But will we stop it in any way? No, we will not. We will not stop it. So I think a lot of religious organizations are not open because their leadership is being very cautious with the health and safety of their congregations. And, we get blamed for that, but we get blamed for all kinds of things. But the fact is, we all have to sleep at night. So all I can do is put out the guidance and hope that people listen and hope that places follow it. And the same thing with the various faith-based organizations. They have to look at our guidance, the state's guidance, and then they have to also maybe they look to other places that have had really some really sad outbreaks in there where people ended up dying. And at the end of the day, they're the ones that have to live with that. So I think that most places are being very cautious and very, very cautious about how to bring people back together again safely.
Final question. Other than COVID, and believe it or not, there are things that you have to worry about other than COVID-19. People have been marching. There has been civil unrest. Would you recommend, if people have been in public places, even wearing face masks, that people should get tested 7 to 10 days after they've been to public events?
Absolutely. You're basically, what you're doing in that situation is you are putting yourself at risk. So if the masking is going to help a ton, but it's unlikely that you're able to stay really as far apart as you need to be at all times during that. So yes, go get tested and find out early so that we can shut down any potential outbreak from that. But yes, public health, it's summer, so we're still dealing with the mosquitoes and the ticks and how to do your summer food without poisoning yourselves and all that type of stuff. Cook your hamburgers good on the grill, all that information. So yeah, things are continuing along here. We still get other diseases that we have to follow up with, and we're still doing our services. So it is nice to have a little bit of a lull in cases right now, because it was very stressful when we had a lot of cases and a lot of hospitalizations. So we are getting back to a little bit of normalcy, but that's kind of the good thing about public health is we can expand and contract and change services super fast. So we're still going.
So wash your hands and wear your mask. That's the update.
Please wash your hands and please wear your mask. Yes.
Jason Liggett, our producer, thank you so much for producing these. I want to thank Urbana Mayor Diane Marlin, as always, for letting us UPTV have their time. And Julie Pryde, Administrator of the Champaign-Urbana Public Health District. What would this community do without you? Thank you so much for your time today.